So imagine going to a clinic, right? You're experiencing this feeling of internal looseness.
Right, a very real, very physical sensation.
Exactly.
Yeah.
And it's causing you distress. But the doctor's very first step, like right out of the gate, is to bring out a camera.
Which, I mean, sounds completely counterintuitive.
It does. And that brings us to our core question today. Can a photograph actually measure internal vaginal laxity?
Yeah, that's the big one.
Because today we are exploring a multi-billion-dollar corner of women's health that is heavily marketed to you on social media, deeply personal, and surprisingly controversial.
Highly controversial, yeah.
We are talking about vaginal laxity and the absolutely booming industry of what they call vaginal rejuvenation.
It is a topic that sits directly at this wild intersection of medical science, high-end cosmetic marketing, and, some very deep societal expectation.
Oh, totally.
And the answer to that camera question is just far more complex than taking a simple before and after picture.
Exactly. And to figure this out, we are drawing from a truly fascinating stack of sources for this deep dive.
We've got a lot of ground to cover.
We really do. We've got clinical studies. We're looking at gynecology guidelines from heavy hitters like ACOG and FIGO. We've got FDA safety warnings. And we're even looking at actual marketing playbooks designed to teach medical spas how to sell these procedures.
Which is eye-opening, to say the least.
It's quite the mix. Okay, let's unpack this. Before we can even talk about photographing this condition or like treating it with high-tech lasers, we have to understand what it actually is, right?
Right.
Because historically, this has been a massive taboo. People just did not talk about it.
They absolutely did not. It was just brushed under the rug. And to get a concrete definition, we look to the International Urogynecological Association and the International Continence Society, the IUGA and the ICS.
Okay, the official groups, what do they say?
They define vaginal laxity simply as the subjective complaint of excessive vaginal looseness.
Subjective.
Exactly. At its core, it is fundamentally a somatic dysfunction, meaning it's a physical feeling, most often noticed during sexual intercourse, resulting in reduced friction.
Right.
And that lack of friction can lead to a really significant decrease in sexual satisfaction for the woman and her partner.
And the statistics in these sources, they really jumped out at me. I think when a topic is taboo, people just assume it's rare.
Oh, but it's not.
Not at all.
Yeah.
One of the studies noted it's reported by up to 48% of women.
Nearly half.
Yeah. And there was another study looking specifically at plastic surgery patients, and 1 in 6 reported experiencing it. But the one that really blew me away, it was from this digital assessment tool called the EPAQ-PF questionnaire.
Right, the EPAQ data.
Yeah. It basically showed that women who have had just one single vaginal delivery are 5 times more likely to experience this than nulliparous women.
Meaning women who haven't had kids yet.
Right. 5 times more likely. That is a massive jump.
It is a massive jump, and it points directly to the underlying biomechanics of the human body, When we look at the causes, vaginal childbirth is the primary factor.
Makes sense.
It is, particularly if the delivery involved an episiotomy, which is a surgical cut made at the opening of the vagina to help with the difficult delivery, or if there was a particularly large baby, or multiple births.
Okay.
Because the physical trauma of childbirth stretches and sometimes actually tears the levator ani.
The levator ani, that's like the main muscle group down there, right?
Exactly. Think of the levator ani as this broad, thick sheet of muscle that acts literally like a trampoline or a hammock at the base of the pelvis.
Okay, a hammock. I can picture that.
It holds up all the pelvic organs,
Right.
and during childbirth, that hammock gets stretched to its absolute physiological limit.
Wow.
But childbirth isn't the only cause. We also have to factor in the natural aging process.
Right, because everything changes as we age.
That's exactly.
Yeah.
You get this general body-wide loss of collagen and elastin, and then, of course, menopause.
The hormone shift.
Yep. The drop in estrogen during menopause leads to tissue atrophy, meaning the vaginal walls themselves actually become thinner, drier, and, less elastic.
See, when you describe it like that, it sounds like a very clear structural mechanical issue.
It does.
Like if I have a hammock in my backyard and it gets stretched out by a heavy weight, or if the ropes just get weathered and old and lose their snap, it's going to sag.
Exactly.
The tension is gone. So my pushback here is, if we know the physical mechanic of why this happens, and we know exactly which muscles and hormones are involved, why has the medical field historically dismissed this as just a psychological issue, or, brushed it off as purely cosmetic?
That is the absolute crux of the issue. And it
Hmm.
comes back to that one specific word in the official medical definition: subjective.
Ah,
Your hammock analogy is great, but unlike a hammock in your backyard where you can easily look at it and see the sag, the pelvic floor is internal.
right. You can't just glance at it.
It's internal, it's complex, and it's dynamic. Because laxity is primarily a subjective feeling experienced by the patient, it is incredibly difficult for a clinician to objectively diagnose and measure it in a standard, universal way.
The doctors generally like things they can clearly quantify, right?
Right. Exactly. A broken bone shows up on an x-ray, high cholesterol shows up in a blood test. When they can't point to a definitive test, the medical field tends to tiptoe around the issue.
Which is so frustrating for patients.
Very. This raises an important question. If a patient sits in an exam room and complains of a feeling, how exactly do you prove it's there?
Which is exactly where things get weird in the clinics. Because you can't just put a feeling on scale.
No, you can't.
Looking at the sources, it seems like doctors are trying a million different things to see what sticks.
Yeah.
You've got these like really long questionnaires like the vaginal laxity questionnaire and the ICIQ VS.
Right, which basically try to put a numerical score on how much distress the patient is feeling.
Exactly. Then there's the physical clinical exam. There's this thing called the modified Oxford scale, where a doctor literally asks a patient to squeeze their fingers and grades the muscle contraction from 0 to 5.
Or they just note if it takes 2, 3, or 4 fingers to feel any tightness at all.
Which, I mean, as you can imagine, is highly variable.
Oh, incredibly variable. It depends entirely on the size of the doctor's fingers and, the patient's immediate ability to isolate and flex that muscle in a high-stress clinical environment.
Yeah, that sounds awful.
It is far from a perfect science.
Right. So, knowing that fingers and questionnaires are subjective, they try to bring in the high-tech gadgets.
Right?
The sources mention perineometers, which you insert to measure the actual squeeze pressure in millimeters of mercury.
Very clinical.
Yeah, and there are these 4D translabial ultrasounds that create moving images of the muscle structure. And this wild thing called vaginal tactile imaging. These are like electronic probes covered in pressure sensors that basically mimic human fingers to map out the elasticity of the internal tissue.
And all of those technological tools are attempting to bridge that massive gap between a subjective feeling and objective data.
They want a hard number.
Exactly. They're trying to measure muscle strength, tissue resistance, and anatomical structure in a repeatable way.
But then we get to the core focus of our deep dive today, the photograph.
Yes.
Can a 2D picture measure an internal feeling? Because it seems like the entire medical aesthetic and cosmetic industry is relying heavily on before and after photos,
They're
right?
heavily relying on them.
To diagnose this condition and to prove to you, the consumer, that their expensive treatments actually work.
They really are. And this is where the science gets incredibly fascinating. Let's look at a specific study from the sources by Mortier and his colleagues.
Okay.
They attempted to use what they called photoanalysis for diagnosing open vagina.
Okay, quite the title.
Yeah. They took highly standardized photographs of the vaginal introitus, which is just the medical term for the external vaginal opening.
Got it.
They meticulously measured the horizontal and vertical diameters and the total surface area of that opening.
They're very precise measurements.
Very precise. And they took these photos while the patient was at rest during a Valsalva maneuver, which is essentially when you bear down or push as if you're having a bowel movement and during a voluntary pelvic floor contraction.
Wow. And the marketing guides we looked at take this even further.
Oh, they do.
There's a playbook we reviewed from a medical marketing company called Wisevu, and they literally instruct medical spa owners on how to take standardized before and after photos for vaginal rejuvenation.
They post on their websites or show in consultations, yeah.
Exactly. They dictate the exact lighting, they tell them where to place the tripod, and they demand specific angles, like the intro angle, the frontal view, the oblique, the supine, and the extreme close-up view.
It's extremely regimented.
They are treating it exactly like you would treat a before and after gallery for a nose job or a facelift.
Precisely. Because the cosmetic industry requires visual proof to sell a procedure. If you are paying thousands of dollars, you want to see a difference.
Right.
But that Mortier study revealed a crucial, fundamental disconnect that completely undermines this marketing tactic.
Oh, really?
Yeah, objective photographs do not always correlate with subjective complaints.
Wait, break that down for me. What exactly did they find?
The study found that women whose photographs showed what a doctor would clinically classify as an open vagina or gaping at the introitus didn't always complain of any laxity or any loss of sexual sensation whatsoever.
Wait, they felt fine?
They felt totally fine. And conversely, women who were actively sitting in the clinic complaining of severe vaginal laxity, who felt incredibly loose internally, didn't always have any visual evidence of an opening in the photographs.
That is wild.
The visual data on the outside and the physical somatic experience on the inside were completely uncoupled in many cases.
But it actually makes perfect sense if you think about it practically.
How so?
Well, trying to measure internal muscular laxity with a photograph of the external opening is like trying to gauge the air pressure of a car tire just by looking at a picture of the tread.
That is a great comparison.
Right. I mean, sure, if the tire is completely catastrophically flat and shredded, a picture might show it.
Sure.
But if it's just low enough to ruin your gas mileage and make the car handle poorly on tight turns, which is a functional internal pressure issue, a 2D photo of the outside of the tire tells you absolutely nothing.
Nothing at all.
It captures the surface, but completely misses the internal functional reality.
That's a very helpful way to look at it, because a photograph only captures the surface topography. You cannot photograph a loss of internal friction.
You really can't.
But, as we see in the sources, the lack of a standardized diagnostic tool and this massive disconnect between what we see on camera and what patients actually feel hasn't stopped the industry from offering aggressive solutions.
Oh, no. It hasn't stopped them at all.
In fact, it has fueled a massive boom.
Oh, a boom is definitely happening. I mean, get this. The global vaginal rejuvenation market was valued at $3.6 billion in 2023.
Billion, with a B.
With a B. And it is projected to hit $14.34 billion by 2030.
That is astronomical growth.
It's insane. Now, a chunk of this market includes surgical options like vaginoplasty, where a surgeon physically tightens the canal with sutures, or labiaplasty, which alters the external folds.
Right, the traditional surgical routes.
Yeah, but the real explosion, like the stuff you are likely seeing ads for on your phone, is in non-surgical energy-based devices, or EBDs.
Yes, energy-based devices are driving a significant portion of this market growth because they are marketed as non-invasive lunchtime procedures.
In and out.
Exactly. These are primarily lasers, specifically CO2 and OBM-YAG lasers, and radiofrequency, or RF, devices with names you might recognize from ads like Morpheus 8V or Votiva.
I've definitely seen those names.
And the mechanism for all of these machines relies on the exact same basic principle: heat.
Okay, I have to guess how this works. I'm trying to wrap my head around the heat aspect.
Okay, go for it.
If I burn my skin on a stove, it scars, right? And scar tissue is usually tighter and less flexible than normal skin.
Right.
Is that what these probes are doing internally? Are they just intentionally burning the inside to create tight scar tissue?
Not exactly scarring in the way you're thinking of a severe burn, but you are very much on the right track with the thermal injury concept.
Okay.
These devices use wand-like probes inserted into the vagina to carefully heat the subepithelial connective tissue.
Which is what?
That's the layer of supportive tissue sitting right beneath the surface lining of the vaginal wall. They are aiming for a very specific, controlled temperature range, usually between 40 and 42 degrees Celsius.
Which is about 104 to 107 degrees Fahrenheit.
Right.
So it's very warm, like a hot tub, but it's not like boiling the tissue.
Correct. The underlying biological theory here is a process called neocollagenesis.
Neocollagenesis. Okay.
Yes. The heat from the laser, or the radiofrequency energy, creates a controlled thermal injury in that subepithelial layer.
So it is an injury.
It is. This minor injury basically tricks the body into triggering its natural wound-healing repair mechanism.
Oh, wow.
Yeah. The immediate effect of the heat is that existing collagen fibers shrink and contract. But the long-term goal of the treatment is that the heat stimulates cells called fibroblasts.
Fibroblasts.
Right. These fibroblasts rush the area and start producing brand new collagen and elastin, while also promoting angiogenesis,
Which is?
the formation of new blood vessels to improve local blood supply.
Okay, so it's the exact same logic they use for laser facials.
It is the exact same logic.
You damage the skin just enough that the body panics and rushes in to build new, tighter, younger-looking tissue to fix the quote-unquote injury.
Exactly.
And the claims attached to these vaginal wands are just incredible. I mean, clinics are promising a thickening of the labia majora, massively increased natural lubrication, tighter vaginal walls, and even improved symptoms of mild stress urinary incontinence.
Like when you leak a little bit when you sneeze?
Yeah. Basically, they are promising a total restoration of function in youth. Here's where it gets really interesting, though.
Okay.
Because whenever you have a multi-billion-dollar industry promising miracle cures based on subjective symptoms, you have to look incredibly closely at the data.
You absolutely do. And when the major medical organizations and independent clinical researchers started looking closely at the data for these energy-based devices, they found some significant, frankly alarming discrepancies.
Yeah, they threw a giant bucket of cold water on the hype. You were showing me this data from the JAMA Systematic Review earlier, and my jaw dropped.
It is a vital piece of evidence in this whole discussion.
Seriously.
If you look at open-label studies where both the doctor and the patient know they are using the real active laser, 93.5% of those studies showed positive outcomes.
Which is huge.
It is. Patients reported feeling tighter, having better lubrication, and experiencing significantly improved sexual satisfaction.
I mean, 93.5% sounds like an absolute home run. If I saw that statistic on a clinic's website, I'd book an appointment tomorrow.
It does sound incredible until you introduce a control group.
Ah, right, the control group.
The JAMA Systematic Review specifically looked at sham control trials.
Sham trials.
Yeah. This is where some patients get the real laser treatment and others get a fake or placebo treatment.
Okay.
The machine looks exactly the same, the motor sounds the same, the probe is inserted exactly the same way, but no actual energy or heat is delivered.
And what happened?
When they compared the two groups, the researchers found absolutely no histological changes with the laser compared to the placebo.
Wait, really?
Really. When they looked at the biopsies under a microscope, the actual cellular structure of the tissue didn't change any more than it did for the women who got the fake treatment.
Okay, wait, I have to stop and push back here.
Sure.
If the tissues aren't actually changing, if that whole neocollagenesis thing isn't happening the way the marketing claims it, why are the patient satisfaction rates so incredibly high?
That's the billion-dollar question.
Even in the sham trials, women reported feeling better. Is this entire $14 billion industry just an astronomically expensive placebo effect? How does a placebo fix a physical feeling of looseness?
If we connect this to the bigger picture, we have to hold two seemingly contradictory truths at the same time.
Okay, let's hear it.
First, the subjective improvement reported by the patient is very real to them. But to understand why, we have to look at how sexual function works. A feeling of looseness often causes immense performance anxiety.
That makes sense.
Right. And when a woman is anxious or stressed during intimacy, her body's natural arousal response is dampened. Less arousal means less blood flow, less natural engorgement of the tissues, and less natural lubrication.
Oh, I see where this is going.
That lack of engorgement physically makes the vaginal canal feel looser, and the lack of lubrication reduces friction. It becomes a self-fulfilling prophecy.
Oh, wow, so it's a feedback loop.
A total feedback loop.
The anxiety about feeling loose actually physically prevents the body from responding in a way that creates tightness and friction.
Exactly. Now introduce the placebo.
Okay.
A woman goes to a high-end clinic, pays a lot of money, receives clinical attention, and is told this high-tech laser will fix her. The act of seeking treatment and the expectation of improvement shatters that anxiety loop.
Because she believes she's fixed.
Right. She feels confident. Because she's confident and relaxed, her natural arousal returns, blood flow increases, the tissues engorge natively, and friction is restored.
That is fascinating.
The placebo effect here isn't just, in her head. Her psychological relief physically alters her body's arousal response.
Wow.
But scientifically, we cannot prove that the device itself, the heat, the laser, caused a structural tissue change. A placebo response, while psychologically valid and physically impactful in the moment, is not the same as a medically proven physiological treatment.
And when you're charging people thousands of dollars for a treatment that might just be a placebo, the regulatory bodies start paying very close attention.
Oh, definitely.
The sources show the heavy hitters are actively stepping in to stop this. Back in July of 2018, the FDA issued a very stern safety communication warning against using these energy-based devices for vaginal rejuvenation.
They did not hold back.
They really didn't. They didn't just say they were unproven. They cited serious adverse events. Because remember, We are talking about applying heat to delicate internal tissue.
Yes.
If that heat penetrates too deeply or isn't controlled perfectly, the FDA noted women were experiencing severe vaginal burns, massive scarring that actually narrowed the canal painfully, and chronic recurring pain during intercourse.
Which is the exact opposite of what these patients are paying thousands of dollars to achieve.
Literally the exact opposite.
And the pushback isn't just happening in the United States either.
Right.
In 2025, the International Federation of Gynecology and Obstetrics, or FIGO, released a very strong declaration. They stated it is ethically inappropriate for gynecologists to recommend female genital cosmetic surgery, which often umbrellas these laser treatments, without a clear, documented medical indication.
So if a woman listening to this is experiencing this very real, very distressing feeling of laxity, and we know that lasers might be a risky placebo and surgery is an extreme last resort, what is the medical establishment actually recommending you do?
They are recommending a return to foundational, evidence-based conservative care.
Like what?
Well, guidelines from organizations like NICE in the United Kingdom strongly advocate for targeted pelvic floor rehabilitation first.
Okay, so physical therapy.
Yes.
Oh.
And I want to be clear, this isn't just a doctor handing you a pamphlet and telling you to do Kegels at home while you watch TV.
Right.
It means working with a specialized pelvic floor physiotherapist. They use tools like biofeedback machines so you can visually see if you are contracting the right muscles. And they provide structured progressive resistance training to genuinely rebuild the strength and bulk of the levator ani muscle over time.
So it's about putting in the physical work to actually fix the hammock the hard way, rather than just trying to magically shrink the fabric with a hot wand.
Exactly. It's structural rehabilitation. And additionally, if the laxity is related to the genitourinary syndrome of menopause, meaning the thinness and lack of elasticity is primarily driven by a lack of estrogen, the gold standard medical recommendation is localized hormone therapy.
Like creams.
Yes, like prescription topical estrogen creams applied directly to the tissue. The medical consensus is crystal clear. You must exhaust these safe, proven, conservative methods before you ever consider touching a laser wand or a surgical scalpel.
Let's pull all of this together. Vaginal laxity is a very real condition. It is not just in a woman's head. It's a physical somatic dysfunction that severely impacts the quality of life, confidence, and sexual satisfaction of millions of women, most often brought on by the massive physical trauma of childbirth or the hormonal shifts of menopause.
Absolutely.
Yet, trying to diagnose it visually, like a medical spa, taking a 2D photograph of the external opening to somehow prove a feeling of internal looseness is fundamentally flawed.
It just doesn't work.
You cannot photograph a feeling, and the internal pressure doesn't always match the external picture. And while the multi-billion-dollar rejuvenation industry promises a quick, high-tech fix with lasers and radiofrequency, the highest quality science we have right now suggests we might be treating a complex pelvic floor issue with a highly expensive and potentially risky placebo.
It really forces us to ask some difficult questions about modern medicine, consumer culture, and marketing.
It really does.
The marketing for these procedures often capitalizes on deep-seated insecurities, pushing what some sociological researchers call the perfect vulva myth, an incredibly unrealistic standard of how women should look and function, heavily fueled by media and pornography.
Right.
But here's a final thought for you to ponder long after we wrap up today.
Let's hear it.
Let's say a woman is deeply affected by this perfect vulva myth. She spends $1,000 on a laser treatment. Afterward, her anxiety vanishes, her sexual satisfaction returns, and her self-confidence absolutely skyrockets.
Yeah.
Even if a sham-controlled trial can conclusively prove the laser didn't actually structurally change her tissue, does it matter?
Oh, wow.
If the disease is partially societal pressure and a crippling loss of confidence, and the cure is an expensive placebo that successfully restores that confidence and allows her body to function naturally again, where exactly do we draw the line between exploitative medical marketing and valid psychological healing?
That is a deeply fascinating and slightly uncomfortable place to leave it. Thank you for joining us on this deep dive. Keep questioning the world around you. Keep looking closely at the marketing you see on your feeds. And remember, just because someone can show you a high-res picture of a hubcap doesn't mean they know what's going on inside the tire.